I'm Kevin, I'm a dentist. I've been a dentist for 10 years, and I had some really terrible nightmare patients that just came along and that were just hellish. They'd been from practice to practice to practice. But once I told Indemnity that I told the patient's name and that I told the patient to go elsewhere, his words were, "Oh, what has she been up to now?" So she was known. Anyways, when I heard that, then I wanted to just kind of fight back against them, which is probably not the most advisable thing to do, but I did it anyway. And it ended up being about 64 A4 pages of complaints from them. I sent them back a few stonking replies as well, to be quite honest. But at the end of the day, I had to just give up and give them back their money because the notes weren't good enough. Some of them non-existent and some of them not good enough. So that led me then to, along with other things, to build in Digital TCO, which is the only real AI voice note-taking software that does kind of what this does specifically for dentists. So that's really the point of it. The point is to give you back your time, and if used to its maximum capacity, to increase case acceptance, which is some of the comments that I'm starting to get back from people, because time is one thing that we don't have enough of. So we'll just get started. Now, I don't usually use Zoom, to be honest. I usually use Google, so I might be a bit messy with it, but we'll see. Right, I'm moving you all over here. So if I'm looking over here, I'm talking to you. And let me just share my screen again. Here. Okay, so this is Digital TCO. Now, the main thing to understand about Digital TCO is that it's very, very adaptable. You can use it in numerous different ways. Today, I'll go over the three main features of it, plus some letters, but it's very, very adaptable. And I'll try and get finished up by Q2 so you can get back to work. You can either record live, so you can have it in real-time note-taking, or you can dictate after the patient has left. Now, if you want to do it live with the patient in the chair, you can also record the audio or not. So it's up to you. If you want an extra medical legal record, you can create that. If not, that's also fine. Let's bring this here again. Okay, so the first thing is Super Dentist cheat mode. The biggest irony about this whole thing is that it takes time to learn how to save yourself time. And it's a big barrier for people to begin because they think, oh, I need to get equipment. I need to get in and figure out how all this is going to work, and et cetera, et cetera. Super Dentist Cheat Mode was built so that you can literally get started in 30 minutes time. You'd be able to go on any microphone that you've got, you'd be able to speak in some notes, and it would turn it into a record, right? So, for example, Mr. Smith attended today complaining that he had broken his front tooth, but he's getting married tomorrow, so ideally he would like it repaired. Medically, no changes. He's a regular attender. On examination, the upper right central incisor has a mesiobuccal cusp fracture. We etched it, rinsed it, applied bond, air thinned, cured it, built up composite A1 with a mylar strip, polished it, checked occlusion. Patient was happy with the appearance. Advised the patient to come back after his honeymoon for a long-term review. So you just present a case. So literally, if you've got any microphone and you can present a case, boom, off you go. So what comes back first of all is, now I'll zoom in case anyone's on their phones. It messes everything up a bit, but you should be able to see. What comes back first of all is the transcript of this. Now at this stage, I don't even really bother reading it. And one of the other benefits of it being me making this is that it works for all different accents as well. So then you send it off to the AI, and what the AI does is the AI will take that and then it will rewrite it into a nicely formatted patient record. So you can see for literally less than a minute, boom, you have a full note. Now, the big advantage of this is, like I said, you can just do that right now. You just present the case, and you have a note. The disadvantage is that this doesn't connect up with any templates. You literally just have the transcript and then it turns it into a note, which is good. So that will then bring us on to the next thing, which is treatment notes. We'll do the treatment notes next, and then we'll do the exam notes because it's a logical flow to explain how it works. So yes, you can get started with that straight away. The next parts are with the template-based things, so which is really good that Rohini has shared the template. So let me go and grab this here. Thank you very much as well, Catherine, but I'm going to go with Rohini's because she was first. First come, first served, right? So let me just copy this. Now, one of the second hurdles that we need to overcome is that you think, I'm not really too tech savvy. How am I going to deal with all of this? Digital TCO was built to be easy to use, easy to update, and easy to train the staff. And if you've got any questions when I'm going through, stick them in the chat as well, and I'll get them at the end. Because we don't have enough time. So when you log on to this to try it out, there is a sidebar that it will take you through, and it'll take you through how to set it all up. So we're just going to do a treatment. I'll show you how you would set it up specifically for you, and then we'll do it. So you would go set up a treatment template, and it's going to guide you through this bit by bit here. You know, idiot's guide, honestly. Select the composite. So you just pick the composite. Here it's here. Now the templates are all just basic text. So I will put in the template that Rohini has given us. Dental nurse. The way Digital TCO works is you give it a baseline, which you then update with problems. It technically doesn't write notes. I'll explain that a bit more when we do the exam. But basically, what it means is you don't want any fill in the blanks, and you don't want any multiple choice. For a treatment note template, all this will be good, apart from you just really want to have like LA, have that blank. You don't want any information about that because we're going to fill that in. The rest of that's good. Again, we don't want any fill in the blanks. So there we go. So that's that template sorted and saved. Then we go to make a treatment note. So again, if you think you're not too tech savvy, you just do this one time and you'll see how it works. So you can put in the patient ID. So let's call him Wee Billy. Next, you pick the teeth. So let's say we did a quad up here. Then you pick the local anaesthetic. That's Articaine for today. And we did the buccal palatal infiltrations. We'll skip the combo for now. We'll skip additional LA. But when you're doing a treatment, you don't really have to dictate it live because you have your standard protocol. Essentially, what you do is you do the same thing every single time, apart from a couple of little problems that occur. So all you have to tell Digital TCO is those little problems that occur, and you can tell the nurse to write it in. So let's say upper right 4 was deep. So that should go during the appointment. Claire, write that in. It was a bit deep and we've explained this, right? Then the other part is, again, you just would present any other problems. So let's say, for instance, the upper right 6, the distal margin had a bit of gingival overgrowth. So we removed that with a bit of electrosurgery. Right, okay. So you get this. Go through this, read this. It will take you through absolutely every single thing. So we've got this back here. I think that's not correct because it should be upper right 5. Then you send it off to the AI. So this has Rohini's template sitting underneath it now, which is filled in for the ideal protocol. Then we have given it a few pieces of information. We've given it the teeth. We've given it the local and the site. We've given it, the nurse has put some deviations from that standard protocol in place. I've told it some other deviations. And then again, we have a note that comes back. So we have the teeth inside here. We have the local anaesthetic. Now, the batch numbers and expiries are stored centrally within the customized section where all the templates live, so that you don't have to keep on, inputting it in. So you just tell the nurse, when you open a new bag of local, go into the settings in there and put the batch numbers and expiries in, and it will use it automatically. So the rest of this all comes from the template. We have the gingival overgrowth with the upper right 6 with electrosurgery. The upper right 5 was deep. Surgery decontaminant, this all comes from the template, etc., etc., etc. And then you just copy and you paste it into your practice management system. So that's how we work with the templates. The key thing to understand is that the template is a complete protocol. So for the treatments, is your ideal protocol, and you only have to tell it any problems. So that's super efficient. So just as another quick example, let's just say we did a crown prep. So I'll show you how quick you can actually do this. Let's say we did an extraction as well. You just tell it the teeth that you did, the local anaesthetic in the site, the local anaesthetic in the site, the upper left 6 mesiobuccal root fractured off. I managed to extract it after about 10 minutes with the periotome, but I could see the sinus lining, so I advised the patient to be careful of an oral-antral communication, so it's not to stifle a sneeze. So there you go. So now we'll have the extraction note. I think I've said upper left 6, so anyway, I read the wrong thing, but you'll get the point. We'll have the extractions, we'll have the crown prep note and all of this, and it's all incorporated into the one note, compared to before, where you have to take sections of templates and copy and paste it in and patchwork it all together. This will just do it all in the one thing. So you can see you get the Emacs crown, I said it was upper left 6, blah, blah, blah. And then that there, and it's included the upper left 6 complication in here because I spoke about the extraction. But if you get the gist of how that works. And it will write a note slightly differently every single time, which therefore means it's actually comprehensive and not comprehensive, contemporaneous. So that's the treatment notes, which then brings us on to usually the biggest problem, which is examinations. Okay, I see Daniel's put a wee question there, so we will get to that. The examination stuff. The whole point of this is to save you time. But by saving you time, like I said, it should hopefully increase the case acceptance. So let's go back to the template again here. The templates for examinations, you don't really have an ideal protocol for a patient. But what you do have is you have your ideal healthy patient. So imagine that you wrote a note for a patient who is completely healthy. They have no dental problems. You said, see you later, see you in 6 months' time. And then you wrote a note for that patient. That is the template for Digital TCO for your examinations. So it's all filled in. Nils, no abnormality detected, lows, low risks, no multiple choice, no caries risk, low, medium, high, no like caries blank. It's all completely filled in, because then again, all we have to do is present the problems. And you can do this live or not live. So I'll do a little example of a live appointment. I'll play both sides of the coin. Okay. Hello, Mr. Smith. How are you doing today? Oh, no, I'm really good, but I was away on a cruise and a bit of my tooth broke off. All right, okay. What happened? Oh, I was eating a bit of crusty bread and it broke off and a bit sore when I press on it. All right, what do you want to do with this tooth? Ideally, if I could keep it, that would be good. Right, okay. Let's have a wee check. Open as wide as you can. Right, we've got a bit of clicking on the left-hand side, TMJ. And if you stick your tongue out, right, we've got geographic tongue. What does that mean? Oh, it's just a benign lesion that we've told you about it before. It just looks like, oh, yeah, it doesn't matter, that's fine. Right, let me just check your gums here. Okay, the BPE is 333/333. Okay, let me have a wee tap on this tooth. Oh, that's a bit sore, that. All right, you can feel that. Okay, the upper right 6 is tender to percussion. Let me just test if this tooth's alive. How are you going to do that? Electricity. That sounds sore. You're not going to feel anything. It's probably dead anyway, Mr. Smith. Can you feel anything there? No. Right, electric pulp test is negative on the upper right 6. Is it okay with you if I take an X-ray picture of this? Is it really necessary? Yes, it is. Right, okay, on you go then. Right, bite on this. Brilliant, you did really well there. Right, let me just have a look at this on the screen and I'll come and have a chat with you. Okay, so we took a periapical radiograph, showed there was deep caries into the pulp, upper right 6, periodicular pathology present, upper right 6, the max bone loss is 60%. Diagnosis is upper right 6, symptomatic apical periodontitis with necrotic pulp. Right, Mr. Smith, basically what it means is the tooth's pretty knackered. The decay in it's quite deep. It's heading underneath the gum. There's a lot of infection around about here. So you've got 3 different options, really. You can do nothing, you can extract it, or you can try and keep it. What do you want to do? Well, I'd like to try and keep it because it's good for my denture. Right, okay. If you want to try and keep it, that would be a root canal treatment. Oh, is that not going to be really, really painful? Well, in certain circumstances, it could be, but remember we referred you before to Dr. Barry. Oh, is that the guy with the microscope and the blue sheet in it? Yep, that was him. Oh, I fell asleep. Yep, you did fall asleep, so you would probably be fine. Right, okay. The thing is, you've got the gum disease round about there, so the foundations aren't really there. You might end up losing it at some point. Right, but I'm 75 years old, so if I could just keep it for even another 6 months, that'd be good. Okay. Just as long as you're aware that it might need to be extracted at some point. Yeah, that's fine. How much is it going to cost me? Well, we'll need to do a crown and indirect restoration for structural Oh, my wife says I should get an Emacs because she had that done with the scanner. Aye, okay, we can do that. So your total cost then will be £1,850. How's that sound? Ah, that's good, that's good. Right. Do you want me to put a temporary thing in it today? No, my parking's running out in 5 minutes, so I'll come back. Right, brilliant. Okay, see you later on. Okay, so there we go. Maybe I need to do some acting classes, but it will pick up the patient, the dentist, that will pick up whatever's going on in the surgery, the nurse chatting or whatever. There's a pause function there. So, someone comes in to bother you, you can pause it. It's not a problem at all. So again, the transcript comes back and then we send this off. So the key thing about this is to understand, now we have a few different pieces of information. Before we've had, with the super dentist cheat mode, you just have the transcript and then you send that off to the note. With the treatment, you have your ideal protocol, which then gets updated. It's the same with the exam, but it's just a bit more complicated, that you have this ideal healthy patient. I call it the healthy patient baseline, that you feed in the information to. And I don't have to tell it any of the negatives. So I don't have to say, oh, there's no swelling. Oh, there's no asymmetry. Oh, they've got lovely lips. All I have to tell it is the patient-specific problems, and then it will update it into the template. Okay, I see some comments here, but I'll come at that in a minute. So if we look at it side by side, the complaints, it takes the healthy patient and then updates it with the problems. Now, I didn't mention a specific social history, so that's why it's kept that the same. Didn't mention any smoking or any medical, so it keeps it the same. The big problem I had with any other systems was I felt I'm always doing the same thing over and over again. I'm telling it like the obvious stuff. It's like, I obviously do that. I've obviously checked that. Why do I have to keep on telling it? So Digital TCO almost presumes that you've checked things unless you tell it. So then again, if you look at this, we've got the clinical examination where it's updated the TMJ. The rest that will remain the same because we've checked that it's healthy. The geographic tongue, same inside there again. If you tell it the patient's age, bone loss, and the BPE, it will do the BSP calculated diagnosis automatically. Now it's put in risk factors, age 75. That's not a risk factor. So you delete it out. I would say you're probably about 98% of the way there most of the time. Didn't mention any of this things, so it would remain the same. But obviously, if I'd said, he's got like a 25mm overjet, it would just go and update it in place. Radiograph report, we've got that added inside there as well, with the details. I didn't specifically state the radiograph report like that. It understands how the radiograph report works. So I just have in here, we didn't take any radiographs, and then it'll update it. It's also figured out the risks. 90% of the time, it will calculate the risks, not all the time. So if you always want it to do something, you have to tell it. Anyway, so then we've got the deep caries, we've got the diagnosis here, and then here we have a discussion about what's going on. It'll give a little summary of the initial appointment, and then it'll go on and on. And if you've had a lot of different options and things, it'll include them all inside here. So there you go. Patient's responses, past positive experience with Dr. Barry, the costs, etc., etc. And then we've got a nice treatment plan as well at the end that expands on. So you get a much more detailed note, and that's so you've done that live with the patient. You've got a much more detailed note that's done instantaneously after the appointment's done, and then you just copy and paste it into the notes. Okay, letters. Good. Someone's asked about writing a referral to a specialist. Perfect. Perfect timing. Right. So you copy and paste that into the notes. So that's like your main notes. That's how you handle random situations, super dentist cheat mode, exam notes and treatment notes, surprisingly for exams and treatments. The letters. It takes about like 1 minute for that to load. So all you have to, so it automatically, saves everything into the notes list here, right? So we've got these notes that we've created and it's just saved by the time. You can put in information if you want to or not. So let's load this up. Digital TCO has, since someone's asked about referral, maybe there isn't, and if the note has to contain referral, and then it should show a referral button. So if we go back to this here, zoom out a bit because it messes it up. I'll push the button down here. This is the notes list, so it has a few different options. There are different kinds of letters that you can do within Digital TCO. There are the automatic letters, and within the automatic letters, there are patient letters, referral reply letters, and then consent forms. Then there is a whole suite of other letter writing functionalities, which get quite advanced. And they've been built with specialists. So I started with these letters and then they've requested, can it do this, can it do that, and whatnot. So it can now. So what I've clicked here is I've clicked the referral letter. The patient letter, referral letter, and the referral reply letter. Just click I'm going to click the consent button to show you that as well. So this is a referral letter. So you can add your own logo and information and whatnot in here. And then it will write automatically based off of the note. So like the note's like the master hub. Once you have the note, you can ping off all these other pieces of information. So this is the referral to Dr. Barry. It'll explain it all out quite nicely. The diagnosis, the discussion we've had with the patient, concerns and immediate needs, referral request. The big advantage of that is it's automatic again. So you just go on and you press the button and boom, you have a letter. But if you're doing a lot of specific letters, maybe that's too much, right? So there's another feature which is cheesily named Molar Mail, which is a much more customizable letter builder. And you can create any kinds of letters. You give it a letter template and then it will copy that letter template. What I've downloaded here is the consent form section. So within where all the templates live as well, there are consent forms that live in there. And what this has done is, this is an example of the patient letter. So I'll just have a wee skim at that, where it writes the examination in patient-friendly language. Till here. So up till here is the end of the patient letter. And then this, general dental treatment risks. These are pre-saved sections that you can edit beforehand, that you just, that the AI will figure out, okay, what is the treatment plan here? So it will always add in general dental treatment risks, but then it will figure out that the treatment plan is root canal. And you can edit this at other times if you've got a sleepless night, or you want to hide away from people for a couple of hours, you can go in and edit it all. So then the crown, and then we should have a perio there, and it'll do that automatically. So now you have a fully customized, and all these bits again, you can edit it. So you can get a full document, fully customized to the patient, and you can add pictures in as well, just at the click of a button. So that's how that bit works. Now, the other section is the molar mail. What are we at for time? Let's have a look. What I'm going to do is I'm going to do a couple of questions, and then if there's a wee bit of time left, I'll maybe show you the voice charting thing and what you can really do regarding treatment planning things. I think that's getting covered up. So Daniel's asked, what about treatment planning? Is there a deadline each day, like midnight, when all the notes have to be on? Can I use someone else's template who's also using this? Can you recommend a microphone? What's the monthly cost, and is there a free trial period? Will a recording be available after? Yes, I'll have a recording. I'll tell you about the costs in a minute. Microphones. If you want to do live appointment recording, most people use what's called a Rode 2 Wireless Go microphone. However, they cost maybe about £150. If you want to try it out, you can just buy cheap lapel microphones on Amazon for about £30. They work perfectly well, but the problem is they only work for maybe about 2 months because they get constant use and then they'll break. So, yeah, if you want to just try it out, get one of those, and then when it dies, upgrade to the Rode. That's probably the best way to go. Treatment planning things, hopefully I've got a little bit of time and I'll show you that with the voice charting, what it can do. On Digital TCO, there is no deadline. It will save it into the notes list here, and then you can just go back and pull it out. I won't ever delete anything off of this. It doesn't delete it automatically. If you've created all the notes and you want to clear it, you can just delete it at the end of the day. If you're choosing to save the audio, you can delete the audio off of here if you want to download it and add it onto the patient's record, but it'll prompt you a couple of times just to make sure you don't do it by accident. But you don't have to save the audio if you don't want. So you can just select it all and then you can bin them and it will delete all the notes that way. That's the only thing about that. Then as a part for writing a referral to a specialist, yeah, so exactly like that. And then there is you can set it up. So we've got some in here. These are like the molar mail examples. You can have it do pretty much anything. So here's like no contact that I've done for someone, and it was to add a radiograph on as well. So you could upload like the patient's own images and things like that. What's this? I'll just click anything. And then that will create a letter just so you can see. Is there a way or button to press send save after completing an exam note that clears the form for the next patient? Is there a lot of waffle duplication in the notes? So, yeah, we'll come to that. if you're on an exam, so when you're in the notes list, if you want to do any edits or anything, you can reload the exam and you can load it back up. You can add on extra bits of transcript. You can edit things, etc., etc. If you need to clear it, there's a little refresh button up at the top here, top left. Press that and that will refresh. If you feel like there's a lot of waffle or duplication within the notes, it will be to do with the template. So the way we control the AI is with the template. And that's where the learning curve is with digital TCO. If you say some stuff in the transcript and it's not in here, or if it's in here and there's duplication, it's because it's trying to update things. So that's where the template is. So if you're having an issue, what I'll do is I'll send you a little email after this and send me your template and I'll have a look at it and it'll just need a few adjustments. If anything's going on and you think that's weird, don't think the digital TCO isn't working. It does. It's just the template needs adjusted, is usually what it is. Okay, Matt's asked, I've been using digital TCO and working well for exams and some treatments. Templates, yeah. Thing I want more info training on is optimizing letters to patients for consent purposes. Yes. So the molar mail section is the way to go. You can do those automatic letters, but the molar mail is fully customizable. So maybe I think I've got a bit of time to get onto that. No, it's definitely not you, Catherine. It's just the templates. So I'll have a look at your templates and we'll sort that out. So yeah, because we've got some people we've got some people on today who are using it and some people who aren't using it. Now, if you're not using it, I'll put a thing in the chat. I'll put a link in the chat. If you sign up today within the next 24 hours, because what people do is they go, yeah, that's good, right? I need to get set up. I need to get microphones. I need to get this. I need to get that, and blah, 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 blah. And then they dilly-dally and they don't do it. And then they forget about it and whatnot. If you sign up within the next 24 hours, you'll get the normal 28-day free trial. And then I'll add on an extra month for you. So that means for the rest of the year, you've got it for free. And that gives you plenty of time to play around about with it and get it completely set up. But I'm only going to do it for the first 24 hours because after that, you'll just forget about it anyway. So if you sign up with that link today, that will work. Now, I've only got a couple of minutes left. I don't want to keep anybody late for getting back to work. But what I'll do is I'll just very quickly show you the charting thing and then the treatment planning letters, just so you can see really what this can do. So if we go back to this patient here and reload this up, there's a button up at the top here, chart, and it'll bring up the charting. This little box will appear and it tells you how it works. You append the charting in between points. You could do it live with the patient in the chair, but the thinking is at the moment is that it's more of a treatment planning tool rather than creating a charting record. It might get to that point. Anyway, I'll stop waffling on and I'll just do it. Start dental chart. The upper right 6 has an MOD caries. The upper right 5 has MO composite. The lower left 6 is missing. The lower right 6 is a full gold crown. Stop dental chart. Start treatment chart. The upper right 6 for RCT. Stop treatment chart. So you just append it. You just append it between the things. What's happened here? Here, just make sure it was there. Right, okay. And I'm just going to put this, there's different options for discussion. I'm just going to put it there just so it goes a bit quicker. So what it will do now is it will also add that into the charting. Now, like I said, it's not going to get added into Dentally or SOE or anything at the moment. So, but what you can do is create really, really customizable letters. I did start doing a master's a long time ago, but I didn't complete it. Story of my life. But the Stephen Davies in there had this thing where it was like you send the patient a letter where you say the teeth, what's going on with the teeth, and then give them the treatment plan, like a tooth by tooth specific diagnosis to the patient. So we can see that it's added on the missing tooth, which is black here. The blue is the composite. We've got the red caries added on, and then we've got the full gold crown. Just keep let this running. Yeah, Rohini, just send me I'll send you an email afterwards as well. Not a problem. Got there. Sort this out a lot. Waiting on this to load. Because it's going to rewrite the note out as well here. And then from this we can do these letters. Now, the other thing is with any of these other treatment planning softwares that exist, that normally you just get like a pictorial chart of the patient's teeth, like a dental chart, and it might draw lines on it for bone loss and things. I think that a patient would look at that and go, what on earth is that? Like, I have no idea what that is. So we've got the charting added on, and then we have the root canal charted here. So then within the molar male, there is one that's called treatment plan that you have access to. Let me go into my images. Let's go accelerate occlusal here. Yeah, okay. So you can upload the patient's image. You can add in different things. Now, this here, you can just chart up on the patient's own teeth what's going on. And it's just, you just do it with the scroll wheel. So it's really kind of quick and easy to do it. Right, there you go. I've done it a bit neater, but I'm just trying to think over the time. So what this letter will do is we will now have a letter where it will do the automatic patient letter like it did before. It will then give us a picture of the patient's teeth, a picture of the patient's teeth marked up. It will then give us a table saying, here's your teeth, here's what's going on with your teeth, so that the patient can actually look at it. And then it will give us the consent forms and then other information. And again, this kind of letter is fully customizable. You can build it to do whatever you want. This part of it, this treatment planning part, is on a little process at the moment. So the charting thing, there's something really cool that I want to do with it, but this was the first stage, was to do this into the letter. I've got someone else working on a little something in the background that might take a bit of time, but hopefully it should be really cool. Because I think that the letters are pretty boring for a patient. It would be good if we could give the patient something which was a bit more engaging, but had all the same information as a letter, but also I'm going to add a signing feature onto the letters as well, but instead of signing it, it would be good if we could actually track the patient's engagement through the consenting process so that we can go, no, you did look at this if they complain. Here's your note, here's the letters I've sent you, here's the other things we sent you, and you looked at this and you agreed that you understood it and whatnot. Anyway, so there's the letter, right? Patient letter section up to there again. I was playing around a bit. I've added in some other pieces of information and whatnot there. We've got the picture of the patient's teeth, picture of the patient's teeth marked up. We now have the charting listed out in a nice table. That's just another stock. You can add stock images in as well. I've been playing around about with this. But then we've got the root canal again, the crown, same as before, the perio, and then a nice wee sign off at the end. So that's how that works. But if you want to help me to help you set that up, just let me know. Send me an email. So that's about it, really. We've come to the end of it. I am super passionate about this, and I hope you can see why. It's really built to hopefully just try and make your life just a little bit easier, but also to make your life easier, but also to help just have a bit of that protection. So if someone complains, you can just go, no, you were told. This is the whole point behind it. And the more people that use it, yes, Catherine, you can. You go customize profile here, and you can add in your logos and things like that as well. You can also choose charting methods and set up all the bits and pieces here. Anna's asking, do you need patients' permission to record the conversation? So if you are going to save the audio, yes, you want to get written and verbal consent. There's a consent form that lives within the communication, knowledge center, and here audio consent form. There's information, and then there's a consent form. You want to get that written, so just give them it at the same time as the photograph consent. If you're not saving the audio, you don't have to get any written consent, because it's like there's an invisible friend writing the notes in the background. It's a good idea to tell them, look, I've got an AI device that's listening. It's going to help write the clinical records. And if they decline all of that, say they go, I don't want anything listening at all, it's not the end of the world, because you can still use it. You just untick the save audio, and then you can dictate after the appointment. So that's how it's really, really adaptable. Some people will just have a microphone on, do the examination and speak out the stuff, and then just have it deal with the deal with the discussion separately afterwards. It depends on how you want to do it. Are the template letters filled in that we can then alter? So for the yes, yes and no, the automatic letters, we'll just do it automatically. The molar mail, which is that big treatment planning letter, is like a drag and drop section. The way that it works is it's just like a simple logic puzzle. You give it an example note for Mr. Smith. So here's Mr. Smith's note. Then you would write the letter for Mr. Smith using different sections, right, that you can drag and drop in. So now you have Mr. Smith's note, Mr. Smith's letter. Then you just feed in wee Davy's letter, wee Davy's note, and it'll write a similar letter for the other patient. It is easy to do. It's just drag and drop sections. And it's how that works. So yes, so thank you very much for everybody for coming along and having a look and seeing what's going on. Yeah, I'm super passionate about it. If you are using it and you have any suggestions, let me know, especially the good, the bad, and the ugly. The things that you want it to be better or the things you want it to do, let me know because I will always add it. And the more dentists we get on, the more that it can be developed into what I actually envisage it to be. So it's just gone strength from strength. But at 700, we just peaked over 700 dentists yesterday, which was my birthday. So that was a nice birthday present. It's done over 220,000 notes. So hopefully we can just keep going. So thank you very much for everybody for coming along. I'll put the links in there. That is the best price that you can get. I did put a podcast with Jazz Galati. If you don't watch his Protrusive podcast, watch it. It's very, very good. He's also got an excellent app that is just thank you for the cakes. He's got an excellent app as well, so I'd recommend going on and having a good thing there. It's a really good community. But if you sign up with Jazz's link, you get the best deal, and then I'll keep an eye on it. And over the next 24 hours, I will give you an extra month free. So thank you very much for your time today. I appreciate it. Keep in touch with me. My email is kevin@digitaltco.co.uk. And with that, I think we shall leave it there. Okay. Oh, it was your birthday as well yesterday, on the 18th. Fantastic. Oh, 19th yesterday. Okay, that's not a problem at all. Probably had too many. How many glasses of wine was it? Yes, good. Okay. Right. Lovely, lovely to see you all. Enjoy the rest of your afternoon. Ciao for now.